in the public and private school system in the US. Having agency of your own body and having agency of your emotional well-being, like for example, you needing to get up and use the restroom for 2 minutes, or walking out and saying like, oh no, I need a sensory break. That wasn't a thing in school. I don't know if it is now, but that wasn't a thing. And I think that kind of kickstarted the censorship of tuning into your own emotions and tuning into your own body, where you're always stuck with like producing and performing to other people's expectations, which then fuel that sort of silencing rhetoric of your mental health, especially when, like, for me as an Asian American woman, I remember going to school, witnessing that type of rhetoric, and then applying that to the household and with a parent and a caregiver that also agrees with that type of rhetoric and also explains it in a way where they add on to their own projections and their own traumas from war, genocide, violence. It makes it even harder to talk about. Even just with my friends, there's always this sense of like you have to hide that you're like getting emotional, or like you say sorry that you're getting emotional because it's like an inconvenience or something. They're like, I don't want to cry in front of you. And I'm thinking, why? Why not? I see friendships as like you being whole. And I think, especially for my friends who are persons of color, that rhetoric is much harder to conceptualize because there's a lot of pressure. I think we grew up in a system where we see our disabilities or our mental health as a liability rather than as a human asset. You deserve to have fun and to laugh together, but you don't deserve to cry by yourself or go through struggles by yourself.